In today's Your Healthy Family, we're talking about the sacroiliac joint, also known as the SI joint, and the debilitating pain it can cause people. Tricia Shannon's a Colorado Springs resident who lives an active, healthy lifestyle these days, but that wasn't always the case.
Probably about 15 years ago, I was running on a treadmill, and I just felt it felt like it popped out. And I remember I went to the doctor, and he could tell by the way I was walking that he said I had an SI joint issue. The way I could describe it is like if I leaned forward to brush my teeth, it was just a sharp shooting pain down my leg.
And that pain had a huge impact on Tricia's life.
A lot of suffering, a lot of just kind of putting my life on hold, just afraid to do so many things because I never knew when it was going to do that again. It could be the simplest movement of making the bed or just picking something up at the grocery store, and I would be where I had to be taken out in a wheelchair.
Dr. Paul Stanton with Colorado Springs Orthopedic Group, located on the North Campus of UC Health Memorial, says many times SI joint pain can be hard to diagnose.
The SI joint is the joint that unites the spine and the pelvis. You have two of them, a left and a right, and it can be a source of arthritic pain. Most patients that have SI joint pain complain of pain focally around the SI joint, but they can also have some radiating pain down the leg. Hip pain, back pain, muscular pain, back joint pain. So there are many things that can cause pain in that area, and sometimes it's difficult to unwind what the pain generator is. When the SI joint is identified as that pain generator, then that really streamlines the treatment process.
These days, Tricia's SI joint pain is nothing but a memory, thanks to a new procedure called iFuse. But her journey from onset to surgery took more than 10 years. Dr. Stanton says not everybody who suffers SI joint pain will require surgery.
Many patients with SI pain can be successfully treated with chiropractic care, osteopathic manipulation, physical therapy, injections, or radiofrequency ablations, which are pain procedures to help.
Next week in Your Healthy Family, we're going to learn more about that new iFuse procedure and go into the operating room with Dr. Stanton to watch it happen, and we'll tell you how Tricia's procedure has changed her quality of life. For Your Healthy Family, I'm Ira Cronin. For more health stories, head to yourhealthyfamily.com.